All right, hi there, Todd Christie, Michigan Dental Association Speaker of the House. Thanks for joining us here. And again, I am joined by Deb Peters, former speaker and immediate past president, but soon former president of the Michigan Dental Association. And coming through to talk a little bit about some questions that came up from the House survey. And here was the next one that came up regarding components and their application, how they work with the House of Delegates and the overall Michigan Dental Association. Because Deb, I know we've had this conversation for the last 3 years and talking about what is the role right now for the components and the delegates and alternates throughout the year in bringing ideas to our board and to the association? How do you see that role for them?
So the role for the components, because the components are our lifeblood of the Michigan Dental Association. Everything starts local. So we want those local issues to be filtered up throughout the year. So I would like to see the components bringing their questions, their issues, and their ideas to board members every month, every week throughout the year. Of course, as it gets closer to annual session, House of Delegate members tend to focus in on what is the business of the House that I can bring forward. And certainly they can bring forward resolutions for that body, the House of Delegates, to consider at our annual meeting as well.
Mm-hmm. Well, and I know that's one of the nice things that we do have right now, and I know is under your presidency, I believe is when we started that, with the board contact with the components. And so every president from the component, as well as if there's an executive director or executive secretary, is contacted by a member of the board to check in and say, is there anything you'd like to bring forward, any concerns that you're having? So we have that, it actually is part of the board meeting. We have the review of the components and what's going on from their perspective, which is a way that I do believe we actually last year might have had a resolution that came out of those from the discussion that we had. I'm trying to remember. We
had a work group that started, very early on, rather than, an idea came up, a concern at the component level, and it came up in June. So our very first board meeting, and immediately the board took action on an idea that a component brought forward, and we started working on that. And that is our component work group, which we're in our second year of. So we'll be updating the House of Delegates and the components on that this year at annual session as well. So, issues can come up anytime throughout the year. I encourage component leadership, take advantage of that contact. We want to hear what concerns you have. We also want to hear, what's going well. Why keep reinventing the wheel,
and that's the point, because you're able to share that and get that information out through the board to the other components. And this is whether, I know from both of ours with our membership background, is taking the best practices that we find, whether it's in our state, which, by the way, always great ideas from our state in regards to membership, but across the nation, we've got a lot of great contacts that we've reached out with and find those best practices that can help our association grow stronger and grow new members, but most importantly, always take care of the current members that we have. And that's why when we reach out, I know, to our components for our meetings that we have, it's nice to kind of touch base with somebody. And most of and I think looking at it, I know for myself, it's never calling my component and checking in with them. It's checking out to people that are outside our region that we may know or not know yet. And that's a nice way to kind of connect across the state within that, because we are a diverse group on the board from all around the state, which is terrific. But we want to get the perspective of all those members too. So this is an easy question that I always ask, or what I want to ask is, who is the MDA resource to help us with our questions?
So we have a governance manager, Michelle Nichols-Cruz. She is just a wonderful resource. If you have any questions based on governance, how to write a resolution, is there a current policy, give Michelle a call. She's always willing to help any person out. She was my go-to person the whole time I was speaker.
Yep, and I've learned that as well in my time, especially when I worked with her before. We even had it, I know you and I, when we were down at the House of Delegates for the American Dental Association. I had my computer on, it popped up with an email from a member dentist, and they had a question regarding to the ethics manual. And so from a note, I turned to Deb, then I turned to Michelle on the other side, and lo and behold, you had a resolution that coming Michigan Dental Association House, all based on a question. Reach out to us. I would be more than happy to take any phone calls. I know any of your board members would when it comes to options and opportunities there, but Michelle always is the go-to as our governance manager in helping us get through these because we work together as a team, and then reaching out wherever it is within the MDA team up here in Okemos to see where can we pull assets from to get these done. I know we've done that quite a few times. And I know one thing, I think when you were coming off as speaker, when I was lucky enough to take over, we had those component, or not the component work group, but other work groups have come from components recommendations or asking for. One was excellent, and we're doing more of it now, is with video conferencing that we're using by Zoom. That was based on a resolution that came out of a component to the House of Delegates, which brought it to the board, and then we moved on from there. That one, I think, has changed the way our association works. I believe that work group did its job in how we now can present, and people from all around our state can be involved where they want to be and when they can be. And I know that's helping foster really great relationships that we have as well. All right, so a resolution that you and I would read off, for the House, a resolution that comes to the House, let's say from a component, it's a little bit of a different resolution than one that the board does. And I know why don't you talk a little bit about that for me?
Sure. So the House is advisory to the board, so any resolutions that are coming forward that they're requesting policy or they're requesting a study of is an advisory. And what that basically means is they're just urging the board to take a look at something, or they're urging the board to consider another action. How that would look in a written form is, we urge that.
Right.
You're not coming right up, but you can put a lot of particulars in your resolution, especially when you make a work group.
Right, in the work group, and that's the one that I can always look back on and say, that the House of Delegates urges that the Board of the Michigan Dental Association form a work group chaired by the speaker to review this area with a report back to the following year's houses. Most times that we'll see those. And that works really well because, and they've been as particular as to who will be on that, whether representation, but the House is who gets to decide where that resolution, the content, that how many meetings. Most times it's also with the financial implications, and again, we always will defer and look at the cost for what it is for doing that. Our governance manager is pretty good about saying, here's what the fees are typically for that, so we make sure we're finding the right spot in our association for the money to come up with that too.
I think the best thing about an advisory resolution is you don't have to think of every detail too. So that can be further refined when it gets back to the board, because they have a timeline of when to enact the House resolution. So if we think of something later, it can be added on. Prior to that, you really can only follow what was adopted. So it's an advisory resolution. It can be further perfected. It can be added on. I think it really makes for a better business resolution.
Right, and with the advisory resolutions, I know as well, it's a time frame also for when they need to be addressed by the board in whatever manner they're going to go to. Typically that will be by the meeting that we have in the fall, whether it's September, October, is when we're seeing with those with the timeline that we have. I think it's for what we have in our bylaws for how we follow through with resolutions that are coming through. So there's a lot that goes into it, but the one thing I agree, we've talked about this through the years, is getting that information from the components, from the members, the grassroots members who see stuff that neither Deb nor I nor the board may or may not see, but bringing it forward, because that's just going to help us be stronger, help our member dentists succeed going forward, and be for a strong association. So thanks again, Deb. Appreciate with your feedback here on components and all the fun stuff we can get there. Thanks a lot.
My pleasure.